How to monitor your blood sugar at home, a complete guide. Monitoring your blood sugar at home is a crucial part of managing diabetes effectively, especially for individuals with type 1 diabetes or those taking insulin. Using tools like a glucose meter with test strips or a continuous glucose monitor, CGM, you can track your levels and make timely, informed decisions about your care. Your healthcare provider will guide you on how often and when you should check your blood sugar, based on your unique medical needs. Why monitoring blood sugar matters. If you are living with diabetes, learning how to monitor your blood sugar at home allows you to understand how well your current treatment plan is working. It provides real-time feedback that helps you manage your condition day to day, or even hour by hour. Blood sugar readings guide essential decisions regarding your diet, physical activity, and insulin dosage. These insights become even more critical when blood sugar levels are affected by variables like food intake, medication, physical exertion, illness, or hormonal changes. What can affect your blood sugar levels? Factors that typically raise blood sugar. Consuming carbohydrate-rich foods. Missing doses or underdosing diabetes medications or insulin. Reduced or inconsistent physical activity. Taking corticosteroid medications. Experiencing illness, undergoing surgery, or facing high stress. The dawn phenomenon, a hormonal early morning spike. Smoking or dehydration. Hormonal changes during puberty. Factors that commonly lower blood sugar. Skipping meals. Overdosing diabetes medications or insulin. Engaging in physical activity. Situational or variable factors. Menstrual cycles. Timing of meals and medications. Alcohol consumption. Interactions with non-diabetes medications. Due to this wide range of influences, monitoring your blood sugar at home is the only reliable method to detect fluctuations accurately. Consistent tracking enables you and your healthcare team to tailor your diabetes management strategy to fit your needs. How to monitor your blood sugar at home, tools and methods. If you have diabetes, learning how to monitor your blood sugar at home is essential to staying in control of your condition. There are two primary methods to do this effectively. Using a glucose meter, finger stick method. Using a continuous glucose monitor, CGM. Your choice of method depends on various factors, including the type of diabetes you have, your healthcare provider's recommendations, your access to the technology, and your insurance coverage. Glucose meters and finger stick testing. The most widely used method for home blood sugar monitoring involves a glucose meter and test strips. This is commonly known as a finger stick test. Here's how it works. You prick your fingertip with a small lancet to obtain a drop of blood. The drop is placed onto a test strip inserted into the glucose meter. The meter provides your blood sugar reading within seconds. Since finger stick tests only provide a snapshot of your glucose level at a single point in time, many people, especially those who take insulin, need to check their blood sugar multiple times per day. Glucose meters and test strips are available at pharmacies, through mail order programs, or directly from healthcare providers. Many brands and models exist, and your provider can help you choose one that suits your needs and lifestyle. If you have health insurance, be sure to check which glucose meters and test strips are covered under your plan. Coverage often varies by brand. If you don't have insurance, speak with your provider about lower cost or community-supported options. How to monitor your blood sugar at home using continuous glucose monitors, CGMs. Continuous glucose monitoring, CGM, systems offer a highly effective way to monitor your blood sugar at home around the clock. Unlike finger stick tests that provide a single reading, CGMs continuously track your glucose levels and display trends over time, giving you and your healthcare provider a more comprehensive understanding of your diabetes management. How to monitor your blood sugar at home using continuous glucose monitors, CGMs. Continuous glucose monitoring, CGM, systems offer a highly effective way to monitor your blood sugar at home around the clock. Unlike finger stick tests that provide a single reading, CGMs continuously track your glucose levels and display trends over time, giving you and your healthcare provider a more comprehensive understanding of your diabetes management. How CGMs work. A CGM system involves wearing a small sensor inserted just under your skin. This sensor measures glucose levels in the interstitial fluid, the fluid found between your cells, and transmits data to a receiver or smartphone app. Depending on the brand and type, CGMs may work in conjunction with an insulin pump, operate independently, send real-time alerts when glucose levels are too high or too low. These alerts can be especially valuable in preventing hypoglycemia or hyperglycemia before symptoms become severe. Important considerations. Although CGMs offer convenience and valuable insights, they are not flawless. Like all technology, they can occasionally malfunction or provide inaccurate readings. If your symptoms do not match your CGM reading or if you receive an error, it's essential to confirm the result with a fingerstick test using a glucose meter. Discuss CGM options with your healthcare provider to determine if this technology is appropriate for you. Insurance coverage for CGMs varies, so check with your insurer to learn which brands and models are covered under your plan. Tracking and sharing your blood sugar data. Both glucose meters and CGMs offer ways to track and store your blood sugar levels over time. Many systems connect to smartphone apps, allowing you to log and review trends. If you do not use a smartphone, maintain a written record that includes the date and time of each test, whether the test was taken before or after a meal, any relevant notes, such as activity level or symptoms. Bring your glucose meter, smartphone, or tracking log to every healthcare appointment. This ensures your provider has accurate and complete information to assess and adjust your diabetes care plan. How to monitor your blood sugar at home, step-by-step instructions and testing frequency. Understanding how to check your blood sugar at home is a vital skill for anyone managing diabetes. Whether you're using a traditional glucose meter or a continuous glucose monitor, CGM, accurate readings can help guide treatment decisions and improve your long-term health outcomes. How to check your blood sugar using a glucose meter. To check your blood sugar at home with a glucose meter, follow these general steps. Wash your hands thoroughly. Any residue, such as food or lotions, can alter your result. If soap and water are not available, use an alcohol wipe to clean your fingertip. Insert a test strip into your glucose meter. Use a lancing device to prick the side of your fingertip. This typically produces a small drop of blood. If needed, gently squeeze your finger or choose another finger to obtain enough blood. Place the edge of the test strip against the blood drop. Wait for the result. Your glucose level will be displayed on the meter's screen within a few seconds. Every glucose meter is different, so be sure to consult your device's instruction manual for the most accurate and safe use. How to use a continuous glucose monitor, CGM. If you use a CGM, the process differs. Your device manufacturer or healthcare provider will provide training on how to insert the sensor under the skin, connect the device to your reader or app, interpret the continuous data stream. Each CGM system functions uniquely, so following specific instructions for your model is essential. How often should you check your blood sugar? The frequency of blood sugar monitoring varies depending on multiple factors, including type of diabetes, medications or insulin therapy, overall health status, pregnancy, recent illness or surgery. Your healthcare provider will recommend a schedule based on your individual needs. However, you may need to monitor more frequently if you take insulin, are pregnant, experience frequent episodes of low blood sugar, have difficulty staying within your target blood sugar range, cannot sense the warning signs of low glucose, are recovering from surgery or illness. How to monitor your blood sugar at home, when to check and why it matters. Knowing when to check your blood sugar is just as important as knowing how. While your healthcare provider will personalize your testing schedule based on your condition and treatment plan, there are general guidelines and critical moments when blood sugar monitoring becomes especially essential. When should you check your blood sugar? Your provider will offer individualized recommendations on the best times to monitor your glucose levels. However, certain situations make testing more crucial, particularly when you experience symptoms of low or high blood sugar or when you're adjusting your treatment strategy. Routine times to consider checking your blood sugar at home include: first thing in the morning, fasting glucose. Before meals. 1 to 2 hours after meals. Before and after physical activity. The bedtime. During the night, especially if you suspect nocturnal lows. Anytime you feel symptoms of high or low blood sugar. Recognizing and responding to low blood sugar, hypoglycemia. Most individuals with diabetes experience symptoms of low blood sugar when their levels fall below 70 milligrams per deciliter. These symptoms are your body's alert that you need to take immediate action. Common early warning signs include dizziness or lightheadedness, intense hunger, shaking or trembling, sweating, a rapid or pounding heartbeat, anxiety or a sense of fear, weakness or fatigue. If you experience any of these symptoms, it's critical to check your blood sugar right away. Confirming the drop in glucose will help determine the appropriate response. How to treat low blood sugar at home. Once confirmed, low blood sugar should be treated immediately with fast-acting carbohydrates. Good options include a small glass of fruit juice, e.g., apple or orange juice, glucose tablets, a banana or small piece of fruit. Severe hypoglycemia can be dangerous or even life-threatening if left untreated. That's why consistent monitoring and prompt treatment are key components of effective diabetes management. How to monitor your blood sugar at home. Understanding high blood sugar and key times to test. If you're managing diabetes, it's essential to know how to monitor your blood sugar at home, not just for daily stability but to prevent serious short- and long-term health risks. In addition to tracking low blood sugar, it's critical to understand high blood sugar, hyperglycemia, its symptoms, and when testing is most effective throughout the day. Recognizing high blood sugar, hyperglycemia. For most people with diabetes, blood sugar levels above 180 milligrams per deciliter are considered elevated. However, symptoms often don't appear until glucose levels reach 250 milligrams per deciliter or higher. If you're not testing regularly, this delay in symptom onset can make hyperglycemia go unnoticed and untreated. Common symptoms of high blood sugar include increased thirst and/or hunger, frequent urination, irritability, blurred vision. If you take insulin, your healthcare provider will give you a specific plan to address high blood sugar, including how to adjust your insulin dosage. If symptoms of high blood sugar are accompanied by nausea, vomiting, or fatigue, contact your provider immediately. These may be signs of diabetic ketoacidosis, DKA, a potentially life-threatening emergency. When to monitor blood sugar during the day. Testing your blood sugar at the right times provides valuable insight into how well your diabetes management plan is working. While your provider will tailor recommendations to your specific situation, here are the most beneficial times to check your blood sugar at home. Upon waking, fasting glucose. This test helps assess your overnight control and guides morning treatment decisions. Before meals. Checking before eating allows you to make informed decisions about insulin dosing and food choices. 2 hours after meals. This post-meal test shows how your body is responding to food, helping your provider assess medication effectiveness and dietary impacts. Before and after exercise. Exercise typically lowers blood sugar, but in some cases, it may cause a temporary rise. Monitoring helps you adjust your routine safely. Before bedtime. Testing at night can detect trends in high or low glucose levels that may persist while you sleep, especially important if you're prone to nighttime lows or highs. Why this matters? Understanding both how and when to check your blood sugar at home empowers you to prevent complications, fine-tune your diabetes treatment, and live a healthier life. Regular monitoring, paired with timely interventions, remains one of the most effective tools for managing diabetes safely and effectively. How to monitor your blood sugar at home. Understanding target ranges. Knowing your target blood sugar range is an essential part of effective diabetes management. When you understand what numbers to aim for, you can make better decisions about your treatment, lifestyle, and overall health. What is the target range for blood sugar? If you have diabetes, your ideal blood sugar range will be personalized by your healthcare provider. These targets are not one-size-fits-all. They're adjusted based on your overall health status, medical history, age, and specific conditions. Factors that influence your target range. Your blood glucose targets may change over time depending on how long you've had diabetes, your age and life expectancy, coexisting medical conditions, e.g., Cushing syndrome, gastroparesis. Presence of diabetes-related complications, e.g., neuropathy, retinopathy, nephropathy. History of cardiovascular disease. Hypoglycemia unawareness, not feeling low blood sugar symptoms. Pregnancy or planning for pregnancy. Access to medications and diabetes technology. General guidelines from the American Diabetes Association. For most non-pregnant adults with diabetes, the ADA recommends the following blood sugar goals. Before a meal, 80 to 130 milligrams per deciliter. 1 to 2 hours after starting a meal, less than 180 milligrams per deciliter. Your provider may also establish additional targets, such as your fasting glucose level, measured upon waking, and bedtime blood sugar, to ensure optimal control throughout the day and night. Why target ranges matter. Staying within your recommended blood sugar range reduces your risk of both immediate complications, like hypoglycemia or hyperglycemia, and long-term issues such as heart disease, nerve damage, and vision loss. Consistent monitoring and regular communication with your provider are key to staying on track. For more reliable, doctor-reviewed insights on managing diabetes and other health conditions, be sure to subscribe to HeInfo. Your health decisions deserve clarity, accuracy, and support. Let us guide you every step of the way.